I want us to start off with the NHI. I want us to kick off with that bill that you signed in Parliament. Not in Parliament.
At the Union Building. The seat of government.
At the seat of government last week, Wednesday. It was passed by the National Assembly in around December. And it appears to me, and tell me if I'm wrong here, signing it several days before elections was probably a political move. Why did you wait since December to only sign it last week?
When the president is presented with a bill from the National Assembly or from Parliament, he has to apply his mind, and he has to also send it for verification, for scrutiny by the presidency staff and internal people, legal and otherwise. And that whole process is not a short process. So I don't receive a bill from Parliament and then sign it immediately thereafter, because I have a number of options. One of those is to send it back and say, no, you've skipped this and that and so forth. So once I had done that, I then signed it. Now, by the way, there are quite a number of other bills that I'm going to be signing in the next few days or so, because they've been going through a lot of processes. You might recall that Parliament went through a process of approving a number of bills in the recent period, in the past 6 months. And so that process then gets underway in the presidency. And this is not an election ploy, by the way. The NHI has been in the making for 81 years. 81 years. In 1943, the African claims said there should be universal health coverage. And in 1955, when the Freedom Charter was drafted, the same was said, and the United Nations has said in one of their Sustainable Development Goals that there needs to be universal health coverage. So we are implementing what has been in the making for many, many, many generations. Well, the implementation of the NHI is a process. It's going to be phased. It's going to take a while to finally bed down exactly what the national health insurance will be all about. We needed to start somewhere, and this is where we have started. Now, it's not an election ploy. I mean, really, people are naive to think that people will now throng to the polls because there's NHI. There are many things that people give consideration to. Many, many things indeed. And, being able to go to a hospital or to a doctor is not one of those. But in any event, it is here. It is law now. I've signed it into law, and the implementation process commences.
But to be fair, Mr. President, I mean, as soon as you signed it on Wednesday, you didn't waste time. When you were in KZN, you spoke about the NHI. And having been signed and the kind of difference it's going to make. I would like you to clarify to our listeners this morning, because there's an impression out there that after elections, we are going to immediately start seeing the full implementation of NHI. Can you clarify to our listeners that this is a phased approach that may take about 6, and if you're going to have court challenges, it could be even more? No, actually, to clarify it to your listeners clearly, I mean, the implementation of the NHI is going to commence. It's going to take time. It's going to be phased. Even the law itself does anticipate that and does speak to that when the NHI is fully implemented, certain things will happen. So the NHI implementation process is going to be phased. It's going to be a process. And you might want to recall that we started a few years ago to do test drives, if you like, of the NHI implementation. And a number of clinics, a number of hospitals, more clinics, I think, were chosen to be the test drive centers for the NHI. So this has been going on, and talking about it is actually saying one of the things that we have fulfilled this term of government is that we've signed the NHI. Like, for instance, we fulfilled
the implementation of the national minimum wage during this season. And I've been talking about that. These are things that have been done. We have succeeded in bringing down the incidence of load shedding quite drastically in this term of government. So as a politician, I will talk about that.
But at the same time, Mr. President, you have healthcare practitioners who are speaking out of concern. You've got technocrats who are also quite concerned about the way that it's moving around NHI. And then you have business that feels betrayed and left behind. Your response to those pockets who say, we want to come on board, we want to help.
Nothing that we do always satisfies everyone. I think that should be the starting point. Everything that anyone does, you'll find that there are people who agree with it, there are people who don't agree with it. Even the NHS in the UK, when it was introduced, it was not perfect. It was not perfect, and they've kept on revamping it and improving it as they have gone on. But after the war in 1945, they had to introduce the NHS, and it has been reviewed over time. The NHI was voted by the elected representatives of the people of South Africa who are in parliament, and they in their majority voted for it. And that is how we pass laws. And when we pass laws, we take the representations of people into account, and thereafter the representatives duly elected are the ones who then decide on it.
I'll always take you back to a conversation I had with you in 2020 where I questioned about the possibility of COVID corruption. You said it wouldn't happen. We had a conversation the following year following widespread looting and PPE corruption. What says you now in 2024?
Well, you see, we've learned a lot of lessons over time, and particularly also about dealing with incidents of corruption. And I'm the first to concede that when we came to the PPEs, and personal protection equipment, we made a mistake. We allowed everyone in the country to be a provider, a supplier, and a procurer. And yet with the vaccines, we centralized everything. Because we were facing a national calamity, we should have done that with the PPEs as well, because then we would have reduced the incidence of corruption. We made a mistake. I will concede that. But when it came to vaccines, we centralized everything, and there was just literally no corruption, or if at all, it was very isolated.
One, how is it going to be funded? And two, is this an admission through the NHI as government that you actually admit that you failed in managing and offering quality public health care in the public hospitals? That's why now you want to piggyback on the private sector.
Clement, the people who said there should be universal coverage in 1943 were not mad. And the people who said in 1955 there should be universal health coverage were also not mad. And the United Nations, combining all countries in the world who said that we should have sustainable development goals and we should have universal coverage, were also not mad. We have a healthcare system for the rich, for people who are very rich. But what's worse is that we also subsidize them. In my newsletter this morning, I've written about it, that we also sacrifice 37 billion rand for those who are on private health care. And we give them rebates. This is money that the state forgoes, that it should be taxing people on. And the system was configured in that way. And now we are correcting that system. And what is worse is that people who are on private health care are always seeing their costs going up continuously. And when they run out of their benefits, they run to the public health care system.
If the public healthcare system works so well, Mr. President, why are you and your cabinet ministers not using it as many as... Because I know there are a few that say they will go to a public hospital.
I don't think that is a measure to even judge. Quite a number of my colleagues, and I haven't been in hospital for a while, quite a number of my colleagues go to Steve Biko Hospital, which is in Pretoria.
Which ones? I can count two of the ministers who have publicly
said...
No,
but that is not even a measure. We are talking here about the public. I mean, it's like saying, there are people who send children to their private schools. That is the choice they have. But in the end, once we have universal coverage, yes, they will even be able to go to those private hospitals, but it will now be under the NHI. Well, in the end, I mean, we've got to find a way of funding NHI, and that is still to be determined. And that is why NHI is going to be implemented on a phased basis. Now, people want to use scare tactics and say, yes, they are now going to tax us higher and higher and so forth. And we are saying we should embrace this, all of us, and make sure that the NHI is implemented. I was pleased to see that even some voices in business are saying we want to work with government to make sure that the NHI succeeds.
All right.